Hello, my name is Dee White, and I am the statewide coordinator of Connecticut's S&P program, also known as Senior Medicare Patrol Program. The S&P program seeks to empower seniors through increased awareness and understanding of health care programs to protect them from the economic and health-related consequences associated with Medicare and Medicaid fraud, error, and abuse. Educating consumers to prevent health care fraud is the essence of the mission of the S&P program. The S&P program recruits and trains retired senior volunteers to teach their peers to protect themselves against fraud. When Medicare beneficiaries cannot act on their own behalf to address problems, the S&P volunteers work with family caregivers and others to resolve issues and make necessary referrals. Preventing fraud takes a lot of time, preparation, and hard work, but the benefits for Medicare and America's seniors and people with disabilities are enormous. On behalf of the S&P program, I want to thank you for taking time to receive this important information. The following presentation will provide you with additional information on preventing healthcare fraud.
As a caregiver, you need to be aware of your family's medical services. An important step in staying informed is a regular review of the Medicare Summary Notice, or MSN. This notice is sent to Medicare recipients each quarter and summarizes all medical care received, including hospital admissions, doctor services, diagnostic testing, and durable medical equipment. Read the Medicare Summary Notice carefully. Review dates and charges. Be aware that there are separate sections for hospital inpatient, hospice, and some home care charges, Part A, and for charges for other medical services and equipment, Part B. Pay careful attention to the hospital charges. Check these carefully because they are complex. You will want to make sure that the person in your care has received the services listed. Keep a calendar of all medical care, doctor's appointments, tests, hospital activities to use to confirm services. Keep a folder with a record of bills and medical statements in chronological order. If you notice a bill or service that can't be accounted for, call your family member's provider and ask about this charge. If you learn that the charge is incorrect, receive an answer that is evasive, non-responsive, or doesn't make sense, alert Medicare. You will find Medicare's phone number on your Medicare Summary Notice statement. If you have a family member who resides in a skilled nursing facility, look for charges for any services that seem inappropriate to his or her care plan. Some examples of potential fraud may be billing for group therapy, for individuals with Alzheimer's disease or in a coma, providing physical, occupational, or speech therapies that are not medically necessary, billing social or recreational activities as psychotherapy. Awareness matters. For example, if you notice that every nursing home resident has a new wheelchair, take note. This may be a red flag that equipment is being ordered routinely, whether or not it's warranted. When in doubt, question the skilled nursing provider. If you have questions about nursing home, home care, or equipment charges, first call your family member's provider to discuss the situation. If you are not comfortable calling the provider or you are not satisfied with the response, call the Senior Medicare Patrol or Medicare. Consumer health care fraud is a growing problem. Protecting personal information and avoiding anything that seems too good to be true is the best line of defense against healthcare fraud and abuse. Be aware of unsolicited medical supplies or equipment received by mail. Always call your family member's provider if you have questions or contact Medicare. Avoid solicitations. This means any stranger who calls, emails, or shows up at the front door. Let seniors know that Medicare doesn't call, visit, or try to sell you anything. Keep yourself current on consumer fraud and scams. For example, offers for legitimate products or insurance plans that may not be in the individual's best interest. Be aware of offers for financial awards or lottery jackpots, or more recently, calls concerning jury duty. Keep updated on scare tactics, such as the National Medicare card, that can frighten seniors into making poor decisions or purchases. Remind your family member to hang up on all phone solicitations and to let you know when they receive a call. Be aware that you might find the need to undo the damage done by entering into a phone solicited agreement. When in doubt, question your family member about phone activity and check caller ID for calls you don't recognize and follow up immediately. Finally, report all healthcare fraud, abuse, scams, or questionable solicitations to the Senior Medicare Patrol at 1-800-994-9422. If necessary, you can also contact Connecticut Legal Services at 1-800-413-9979. If after you review this presentation you have questions or concerns, please contact your area agency on aging at 1-800-994-9422.
Connecticut's SMP program is operated by each of the 5 regional area agencies on aging. The SMP program is funded by the Federal Administration of Aging, and SMP volunteers are now at work in all 50 states, the District of Columbia, Puerto Rico, Guam, and the Virgin Islands.